Hello, I'm Dr. P.J. Mazumdar from Arogyam Hair Transplant and Cosmetic Surgery Clinic. So today I'll discuss the pre-op procedures and how the procedure of hair transplant goes, the stages through which the procedure progresses. So starting with the pre-op consultation, and then what happens when you arrive at the OT, how your hair is trimmed, what are the steps of the actual procedure. So all these things I'll discuss in today's video. So the first step is the pre-op consultation before the OT. So in the first step, you will come and meet me in my OPD or in my clinic, and there we will discuss exactly what we will do in the procedure. So I'll check your grafts, I'll check your scalp, and I'll discuss with you the number of grafts that you need to do. We'll also discuss the cost of the procedure, any disease conditions that you might have, any medicines that you might be taking. So all these things I'll discuss with you, and it is at this time that you can ask me any question. You can clear all your doubts about how the transplant progresses, what you can expect in the procedure, whatever questions you have in your mind, we will discuss during this time. So now I'll discuss what happens on the day of the procedure when you reach the OT. So you are required to reach the OT around 10 a.m. Usually we start our OT at 10 a.m. and you have to come to downtown, the main OT of downtown hospital in building number 1. So you should come with your full breakfast. You should have your normal full breakfast, and you need to wear a shirt when you are coming, because a t-shirt you have to take out over your head. So a button shirt which you can take out like this. You can come alone. There is no need for a attendant. But if you have an attendant, of course they are welcome to come. But you are also free to come alone. Most of our patients, in fact, come alone. So you will be required to bring with you your investigations, and also you should be ready with your payment in whatever way you can do. So we accept payments through UPI, through cash, through even sometimes checks. But for the last 1 or 2 months, we have not been taking payments through credit cards, because that's why there's some problem with the swipe machine. But you can use UPI, bank transfer, anything like that. So immediately on reaching the OT, the first things that will take place is that our staff will take your history, whether you have any disease conditions like pressure or diabetes, whether you take any medicines regularly, whether you've taken medicines for pressure or diabetes. The next thing is the consent. So we use the regular consent form which is used for every patient in a downtown hospital. So it is a standard form, just the basic things are required. So you have to give your signature for that. So these are the first things we do once you reach the OT. Next step, the first step of the procedure is the drawing of the hairline. This is where I will come in. So the first thing we do is drawing the hairline. So this is a step where I will interact with you, and if you have your attendants, they also can join in. So we will discuss where to draw the hairline. This is very important because the procedure will proceed according to this hairline. Okay, so we draw the hairline in an inverted M shape. So there are some rules of drawing the hairline. I'll explain that in another video. So here basically I want you to know that we will discuss. You have to be happy with the hairline, and I have to be happy also. So once we have fixed the hairline, the procedure will go according to that. That will be the final hairline, and that is how we go. So we use laser machines for hairlines. So that all those things we'll discuss in another video, how to draw the hairline. Next step is hair trimming. So once you have drawn the hairline, your hair will be trimmed. So what we do is the part where we plant hairs, we usually trim down to 1 centimeter and 1 millimeter. Sorry. Next, and the part where we take out the grafts, there also we trim to 1 millimeter. So accordingly, we'll trim your whole head. In case of males, in case of females, of course, there is no trimming. And also in some other cases like eyebrow transplant, so there also we don't have to do any trimming. But in beard transplant, we have to do trimming. So these are the things that we do. But after the hairline drawing, we have to trim your hair. So after your hair is trimmed, the actual procedure begins. And the first step in the procedure is sterilizing your skin and then giving local anesthesia. So this is very important. So first thing that we do is your skin preparation. We use antiseptic solutions to make your skin sterile. We use betadine solutions mainly. The next step is giving local anesthesia. So in local anesthesia, we inject small amounts of local anesthetic xylocaine into along your hairline in the beginning. So this step is slightly painful. You will feel like the biting of an ant. But we use machines like vibrators to reduce this pain. And then we cover the whole head with local anesthesia. So we wait until you are not feeling any sensation at all. So only after that will we begin the procedure. So the local anesthesia is the most important step to prevent any pain during the procedure. So next step is slit making. In slit making, what we'll do is we'll prepare the area with slits. That is also another step that I do myself. So if we have planned, suppose we have planned 2000 grafts, I'll make 2000 slits. So these are the slits where the grafts will be planted. So that slit making procedure is a very important part of the procedure. That is where the angle, the density, the direction in which the hair is directed towards, all those things are decided during the slit making according to how we make the slits. So the slit making process itself, it fixes everything. After that, the planter just follows the slits, and wherever the grafts are planted, you will point in the direction in which the slit is made. So I am very careful with that part of the procedure. I am very careful to make it a very natural looking transplant. So next step is extraction of grafts. So once slit making is completed, we'll now go for extraction of grafts. So in slit making, you are lying on your back in most cases, and we make the slits like this. And then after that, you'll again be asked to turn around. Now you'll be lying on your abdomen, and this is the step when we'll extract grafts. Before starting the extraction, we again have to do skin preparation, and again we have to give local anesthesia, this time at the back. So once this part of the procedure is completed, I will start extracting the grafts. So the number of grafts to be extracted depends on how many grafts you are doing. So suppose you have planned for 2500 grafts in total. So the first day we do 2000 grafts. So in one day in Arogyam, we generally do 2000 to 2200, 300 grafts, not more than that. So the first day we'll plan for say 2000 grafts, and in the first round of extraction, in that case, I'll generally do half. So I'll extract 1000 grafts. So that 1000 grafts will be planted later. So we will do 1000 grafts in total in the first session. Next step is planting. So once the grafts are extracted, we need to plant them quickly. So after extraction, we plant the grafts. So again, you are asked to change your position again from the abdomen. You again lie down on your back, and now the planting starts. Our staff will do the planting. She will plant the grafts according to the direction of the slits that I have already made. So if you have taken up 1000 grafts, 1000 grafts will be planted. After this, we have our lunch. Again, there is another round of extraction. Again, there is another round of planting, and we finish for that day. Okay. So the first day, generally, as I've said, we do about 2000 to 2200 grafts in one day. So we begin from 10 a.m. and by the time we finish, it is generally 7 p.m. sometimes even 8 p.m. If we do 2000 grafts. But if we are doing 1500 grafts, we expect to finish by 4 or 5 p.m. Sometimes in small cases we do 1200 grafts. Then we finish before lunch around 2 p.m. So generally we finish by 7 to 8 p.m. in a case of 2000 grafts. And if you are doing more than that, suppose we are doing 3000 grafts, then you can go home. We'll explain the medicines and whatever precautions you need to take. Next morning you again come at 10 a.m. Again we finish by 2 p.m., 5 p.m., 8 p.m., whatever according to the number of grafts. So in that way we generally finish most of our procedures in 2 days. But sometimes in big procedures, say 5000 grafts, 6000 grafts, we can take up to 3 days also sometimes. That is how the procedure goes. Yeah, so that is how the procedure goes. You need not worry. It is hair transplant is a comparatively easy procedure You get all the time in the world. You can bring your own music, you can bring your books, you can keep your mobile on throughout the day, and you can both take and call other people. So we'll give you time. Anytime you need to use the washroom, you can go to the washroom. Anytime you need to drink water, you can take drink water. Lunch and all, we provide a working lunch from the hospital, that is provided along with the procedure, free of charge. So anything, if you want tea, we can provide tea. So we proceed in a sort of easy manner. There's no rush, no restrictions. So you feel comfortable. We try to keep you comfortable. Don't worry. So the hair transplant is not such a difficult procedure for the patient.